Hi, my name is Amit Jain. I'm an orthopedic spine surgeon. I see patients both at the Johns Hopkins Hospital as well as the Howard County General Hospital. I take care of both adults and children across the whole spectrum of spine disorders. Spinal fusion is an operation by which we stabilize and fix two segments of the back together. It has a variety of advantages. For example, it can lead to reduction of the pain that the nerves are experiencing in that region. It can also lead to stability of the spine in that region, preventing further instability and processes like arthritis. It can stop them from progressing. A spinal fusion may be necessary for a variety of different types of spinal pathologies. For example, the most common reason to do a spinal fusion is it's called spondylolisthesis. It's a fancy word which basically means spinal instability when the vertebral bodies are slipping on each other. So in order to prevent that slipping, we might have to consider fusing the spine in that area. Another reason to do a spinal fusion might be scoliosis, where the spine itself is structurally getting damaged, and in order to fix that damage, we have to do a fusion in order to prevent further damage. Most patients receive the fusion at the levels at which the pathology is. However, the act of performing a spinal fusion does put the adjacent segments at additional risk, and that's something of consideration. Most patients who undergo spinal fusion surgery require a 3-month recovery time. That means 3 months of no BLT, no bending, lifting, twisting for 3 months. However, with modern minimally invasive techniques, a lot of times patients report that they can go back to work and start doing things that they want pretty quickly, even within 3 to 4 weeks. So the variety of minimally invasive techniques have really allowed us to transform this field and really cut down on the recovery time. There's a variety of options that exist in order to take care of spine problems. The most typical option is what's called a laminectomy decompression, where we go in and take away some of the bone spurs that are causing pressure on the nerves. And then in cases where in addition to needing to do that, we also have to stabilize the spine, we may consider adding on the fusion operation. But some patients might only need the laminectomy decompression and may not require the fusion, depending on what their x-rays look like and what their MRIs look like. In a lot of cases, we can perform the spinal fusion surgery in a minimally invasive manner. And this has a lot of advantages as far as patients' recovery, their ability to get back to their life earlier and faster. But of course, in some cases, it's not really possible to do minimally invasive surgery because of the patient's underlying pathology or because of the extent of the disease. In those cases, we have to do open spinal fusion surgery. When that happens, patients generally end up requiring an overnight hospital stay, and the recovery tends to be a little longer.